you tell me how do you feel about his tongue? Tongue body?
Yep.
And tongue coat.
So the tongue is pale and swollen with teeth marks, a thick white coating, particularly in the center.
Yeah, and okay. So how about the left pulse?
So it's slippery in the guan position on the left, and the right is also slippery in the guan position.
Yeah. Thanks. So can you summarize about his background information?
Yes, of course. Yes, of course. So the patient is a 30-year-old male PhD student, no relevant history of health problems. Family's history: mother had IBS for 20 years, and he had an appendectomy when he was 10. And there's no adverse reaction to acupuncture and Chinese herbal medicine previously.
Yeah. Thank you. So can you summarize about his chief complaint and the relevant findings?
Yes. Okay, so he had an intermittent headache for 3 months, that recurring for over 2 weeks. The onset coincided with the start of winter, and it followed a change in diet to raw foods. He has tension in the eyebrows and a dull, heavy pain across his forehead, and the whole head feels tired and heavy. The pain is worse in the morning after eating and when tired, and he rates the pain at 6 or 7 out of 10 when it's the worst, and 3 out of 10 at its mildest. And it is better with rest and is relieved with Panadol.
Yeah, thank you. So what is Tcm disease diagnosis?
Yep, so the Tcm disease diagnosis is headache.
Yeah, so how about the syndrome differentiation?
So syndrome differentiation is phlegm dam obstructing the middle jiao, preventing clear yang from rising to nourish the head, and with an underlying spleen qi deficiency.
Yeah, so what's the evidence of that?
Okay, for phlegm dam obstruction of the middle jiao, there's the slippery pulse, the pale swollen tongue thing with a thick white coat, sticky eyes, nasal congestion and discharge, no thirst, tiredness, heavy body, wakes up feeling tired, dull heavy pain, worse in damp weather, and nausea after eating with bloating. And for the spleen qi deficiency with clear yang not rising to nourish the head, it's a pale swollen tongue with no appetite, bloating, loose stools, frequent pale urination, chronic yang ming headache with dull heavy pain, tension and heavy head, dizzy, foggy thinking, and can't concentrate.
Yeah, so what's the Tcm principle of treatment and method for that?
Yep, the Tcm treatment principle is to resolve phlegm damp, remove obstruction, and harmonize the middle jiao to relieve nausea, strengthen the spleen, promote clear yang rising to alleviate the head.
Yes, so that's principle of treatment, right?
Yes.
So what's your acupuncture prescription?
Yep, so acupuncture in the order of the insertion, so do 20 even method, spleen 4 reducing, PC6 reducing, stomach 40 reducing, stomach 36, large intestine 10, and Ren 6 reinforcing, spleen 9 reinforce, Ren 12 reduce, stomach 25 reduce. And I will retain it for 30 minutes with a heat lamp on the abdomen.
Yeah. So what's your herbal prescription?
Yes, so the prescription is 半夏白术天麻汤, modified.
So what's the ingredients and the dosage?
Yes, so the ingredients are 半夏 15 grams, 天麻 9 grams, 白术 12 grams, fu ling 12 grams, chen pi 10 grams, sha ren 6 grams, yi ren 15 grams, huang qi 15 grams, sheng li 12 grams, gan cao 6 grams. So the dosage is altogether in 112 grams,
Yeah, thank you. So now I'll get the patient back, so you can explain to him and start the treatment.
Okay.
Yeah, thank you.